Good afternoon, everyone. You're welcome to today's video, and today we'll be talking about diabetes. What is diabetes? Diabetes is when one's sugar level is persistently high and higher than normal. What do we mean by normal? Depending on whether you are talking about you have not eaten or you have eaten, is when it's above between 70 to 140. We use a unit called milligram per GL. What do I mean? When you want to check your sugar level, you go to the doctor. There's something they call a glucometer. It's used to check the sugar level. They ask you to come in the morning. Having the last time you ate would have been 12 hours. For example, if you want to do your sugar level today, you would have fasted. Your last meal the day before that is yesterday, would have been, let's say, around 8 p.m. That was your last meal. So this morning, your sugar level should be taken between 8 and 10 in the morning. And that is what is called fasting blood sugar. If they check your blood sugar at that time and it's between 70 and 110 with the units milligram per DL, that is mgdl, if it is above that, then we will say your sugar level is high. But we won't say you have diabetes until it is above 126. And if you come in the afternoon, or as they checked that your sugar level in the morning, they now ask you to go and eat food. 2 hours after, they check it again and it is above 200. We will say you have diabetes. If you join this figure with symptoms that I'm going to tell you shortly, we will say you have diabetes. What are some of these symptoms? Some of these symptoms are, doctor, I am urinating too much. I am going to the restroom before I wake up in the morning, up to 5 times. Even up to 10 times, some people will say and more. You could have diabetes. Or, doctor, I've been losing weight. I just realized I've been losing weight. Though I eat well, my appetite is good, I've been eating well, but I notice I'm just losing weight. And I'm usually very thirsty. So because of that, I keep drinking water. And I get dry quickly, even though I'm drinking water and I'm eating well. I'm losing weight and then I'm getting dry. You could have diabetes. My legs are swelling up. I don't know the reason. All my body is peppering me. My legs are peppering me. My legs are vibrating. They are hurting me. It looks like they are choking pin on my legs. You could have diabetes. Doctor, I cannot see very well. I was seeing previously, but now my vision is looking cloudy. It's looking as if they put cotton wool in front of me. I cannot see things very clearly anymore. You could have diabetes. And so, what are some of the predisposing factors to diabetes? Genetics. If you have any of your siblings, your parents having diabetes, you stand a higher chance to having diabetes. If your mother or your father or her relatives, any of them have diabetes, you are more predisposed to having diabetes. We talk about lifestyle. If you are the kind of person that you like eating junks, you take a lot of coke, you take a lot of sugary content, then you are predisposing yourself to having diabetes, especially when you already have a family history. And then let's not be deceived. There are some few people that will take a lot of sugar and they will never come down with diabetes. Few of them, because their insulin, there is a chemical that helps the sugar in the blood to be stored in the muscle. So when you take any food at all, the food gets digested and goes into the blood. That chemical is released, and it will take the too much of sugar into the blood and take it to the muscle. But if for any reason that chemical called insulin is not being produced, either because you have exposed yourself to too much of sugar, and then that organ that is responsible for producing that chemical has overworked, and then is going through a change. The architecture, that is the structure of that organ, is changing, that it can no more do its function as it should be. Then you are predisposed to have hypertension, to have diabetes. What are other risk factors? Lack of exercise. You are consuming so much than you are giving out. As you consume, you are actually supposed to give out with exercise. Break down some of the fats, especially when you have a lot of fats along the abdominal area. You should burn it off. Exercise. So, to sensitize even the production of this insulin, the chemical that we call insulin. Again, lack of adequate sleep can also predispose you to having diabetes. Someone that has hypertension can predispose you to have diabetes. Somebody that is smoking, or somebody that stays around where they are smoking, somebody that stays around where they are cooking firewood over a long time, you can be predisposed to having diabetes. If you are the one too that is cooking with charcoal wood, with anything, firewood that produces smoke, you can predispose yourself to having diabetes over some time. What are some of these complications? Diabetes has complications. Complications can be from the head to the toe. From the head, it can lead to stroke, it can affect the eyes, glaucoma, it can cause blindness. In fact, diabetes can cause irreversible blindness, meaning the blindness cannot be reversed. Once the person is already blind, even when you go and see the eye doctors, there is nothing they can do. It can affect the kidneys, can lead somebody to be doing dialysis and then be looking for money for kidney transplants. It can affect the nerves, causing someone's body to be peppering him or her. It can also affect the heart. Somebody can get heart failure from the result of diabetes. These are some of the complications that somebody that has diabetes can present with. And that is why we advise from the age of 40, you should do a regular yearly screening where your sugar level will be taken. Or if you have some of these symptoms, please don't go and take a go, because you'll be doing yourself more harm than good and affecting more of the organs to getting complications. So please come to the doctor, talk to us and meet us. We will advise you on further things to do. This is an awareness video. Thank you very much.